Welcome to the show, Tech for Doctors podcast series. Today, I'm speaking with someone whose journey spans from coding as a kid in Nigeria to building an AI powered system that could solve a 23 billion healthcare staffing crisis in the care sector in the UK. He is the founder of Pakare, a visionary and a fighter, Okare Shaba. Okare, welcome.
Thank you, Dr. Baska, for having me. It's a pleasure to be here, and I look forward to this conversation. Cheers.
Excellent, excellent. Good. Right. For our audience who might not know you yet, if you had to introduce yourself in one sentence, who is Okare?
In one sentence, wow, I'll say a visionary leader and a problem solver.
Okay, very good, man. You got it. Okay, excellent. Right. And if you had to pick three words to describe yourself, what would they be?
Three words to describe myself. That's actually a tricky one among plethora of things that I describe or ascribe myself to. I would say the first one and the most important one is consistency.
Mm-hmm.
I show up regardless of the situation, regardless of being sick, regardless of the weather. Like I was
Mm-hmm.
telling you earlier, I actually went
Mm-hmm.
for a jog this morning, even regardless of the fact that it was raining. I had to put on my
Mm-hmm.
jacket on and just went and ran. So I'll say
Mm-hmm.
consistency. I'll say
Mm-hmm.
integrity of purpose, and
Mm-hmm.
most importantly, excellence. So I love to put excellence in everything I do. So whatever I lay my hand to do, I like to achieve the highest potential that I can ever be in that. Right. So that's pretty
Excellent,
much.
excellent. Wow, wow. Okay. That's great, man. So let's move on. You have painted some vivid stories before. Carers traveling 4 hours, mismatched placements, patients left vulnerable. Can you take us into that world? What does chaos actually look like?
Hmm. What does chaos actually look like? I think for me to answer that question, I'll take you back to when I came to the UK.
Mm-hmm.
So when I came to the UK
Mm-hmm.
about 3 years ago, I
Mm-hmm.
landed in Heathrow Airport on a Saturday.
Okay.
Um, got to my destination, and then I
Mm-hmm.
realized that I needed to apply for jobs. I sent my
Mm-hmm.
CV to Indeed, and on
Mm-hmm.
Monday morning my phone started ringing nonstop from recruiters. Oh, they're
Mm-hmm.
seeing my CV, I'll be a good fit for a particular role and everything. But
Mm-hmm.
that call was short-lived each time they asked about my visa status. And
Mm-hmm.
I had to tell them I was on a student visa.
Yeah.
So
Okay.
that led me to an experience where I wasn't employed for about a couple of months. So I was
Mm-hmm.
living off my savings that I came into the UK with. Then a friend
Mm-hmm.
hooked me up with a domiciliary care role where I
Mm-hmm.
went to work in a care home. And
Okay.
I had to travel all for like 4 hours because I didn't know about it. There was no location base, nothing to track it. And
Mm-hmm.
the paper-based system, so many
Mm-hmm.
things like repeated
Mm-hmm.
care logs. You just see if
Mm-hmm.
you look at the care log on each of the care on the patient, you'll notice that
Mm-hmm.
it's just repetitive, meaning that the
Mm-hmm.
person who wrote the last one, you just copy the same thing the person wrote on the next line, and
Okay. Yeah.
administer care at ma,
Yeah.
administer drug at ma. So
Yeah.
that's just it. You just see there
Yeah.
was no ingenuity, there wasn't really any detail about what happened on that shift or on that
Mm-hmm.
care. And that was how
Mm-hmm.
Pado Care was born, to solve
Mm-hmm.
this big problem facing healthcare sector. Yeah.
Mm. Okay. Wow. So obviously coming from a tech background, you straight away thought about, okay, this is something you can potentially address straight away. Your eyes lit up, I guess.
Absolutely. Yeah. When we decided to solve the problem, we
Yeah.
tried, from my experience, I put all the experience into Paduke, but I
Mm-hmm.
was met with one of the big challenge, which is what problem I was trying to solve wasn't the problem the care or the recruiters cared about, or the
Yeah.
agencies or the domiciliary care cared about. So we
Yeah.
built this system for like a year, but we got no traction until
Mm-hmm.
when I got in contact with like a care recruitment agency, and then they told us their own problem. Then we adapted Care to fit in, and there was a market fit, product market
Mm-hmm.
fit, right?
Mm-hmm. So, in your experience, what was the worst mismatch you have witnessed?
The worst mismatch. Wow. I,
Mm-hmm.
literally, I can tell you that there've been mismatch where you see someone who is
Mm-hmm.
a Chinese speaking
Mm-hmm.
carer
Right.
and does not speak fluent English being matched
Mm-hmm.
with someone who,
Right.
like a British older
Mm-hmm.
person. So the
Mm-hmm.
communication is lost. And you just see that, everything is just
Mm-hmm.
robotic. And caring needs to be personalized. Caring
Mm-hmm.
needs to be personal. And that's why we
Mm-hmm.
built the 42-factor AI matching system that matches the
Mm-hmm.
carer,
Mm-hmm.
especially in relation, direct relation, correlation with the care need. So, for
Mm-hmm.
instance, if based on language, race, qualification, skills, the list goes on and on and on. And care mismatch can lead to even worse situation. For instance, in cases like dementia care, I was at a
Mm-hmm.
conference at the care show in London. And when you have recurrent or different people who do not communicate well with people with dementia, it wasn't
Mm-hmm.
the case.
Right. Great. Okay. So, can you recollect at what point did you say enough is enough? I will build something better.
I think it was from the get go. So
Mm-hmm.
my story actually started way beyond even starting care. So I was
Mm-hmm.
adopted at the age of 5 by my godfather, who taught me everything I know.
Mm-hmm.
And when he adopted me, he taught me all, like my
Mm-hmm.
worldview, everything that I am right now is because of how much he had poured into me. But
Mm-hmm.
sadly, we lost him to dementia.
Oh, I'm sorry to know. Yeah.
Yeah, thank you. And
Mm-hmm.
that also led me on on a trajectory to solving this big problem facing. So while we can't create a magic pill that will solve dementia, we decided to
Mm-hmm.
create a tool that will help carers, family members to have that peace of mind. And that's actually
Mm-hmm.
Paddle Care. So Paddle Care
Mm-hmm.
has been an idea that I have had for a long time, even before coming to the UK.
Wow. Wow. Okay. That's excellent. Okay. Good. Um, and obviously, you said your godfather was a doctor, medic back in Nigeria, um, and no other business or entrepreneurial background to start with. Did you doubt yourself at the start?
Did I doubt myself at the start?
Mm-hmm.
Mm, I I don't think so. I knew
Mm-hmm.
it was going to be challenging.
Okay.
I knew it was going to I knew it was going to be challenging, but I didn't know how
Mhm.
challenging it would be.
Right. Okay.
I knew I could pull it off because I've pulled it off before.
Mm-hmm.
This is like my third startup, and
Mm-hmm.
I know that anything new always comes with its
Mm-hmm.
challenge. I need to be
Mm-hmm.
10 times harder because I'm in a new location. I have no contact, no network, no influence, no
Mm-hmm.
contact at all, no phone book,
Mm-hmm.
nobody. I literally have no family member in the
Mm-hmm.
UK. But
Mm-hmm.
we decided I was going to just do this. And when I
Mm-hmm.
said, like I said, I strive. When you said what are three things that describe me, excellence. So I knew that I'm going to put my excellence in everything I do. I'm going to create a product that people like, not just
Mm-hmm.
like that they love. Like
Yeah.
yesterday, we had a meeting with the client, and the client was blown away. I made a post on LinkedIn about it, and you could see the
Mm-hmm.
clients happy. We saved them
Mm-hmm.
over 3 weeks of work with
Mm-hmm.
Paddle Care, just using Paddle
Mm-hmm.
Care. So that is because I truly care. So that
Mm-hmm.
comes across to my clients, and they see it, and then they look like, okay, they can trust me we can do
Mm,
business. And
mhm.
I knew that I knew we will succeed, but the question is, I didn't
Mhm.
know when.
Yeah, yeah. So excellent, excellent. I think I asked the question initially, kind of three words to describe yourself. Probably, I think if I given you one more to add, maybe four words, then based on what you reflected now, I would say courage.
Hmm, courage. That's true. Because I remember last year, last year,
Mm-hmm.
stroke this year, the
Mm-hmm.
only thing that I was going through was
Mm.
never fear. Don't be
Mm-hmm.
afraid. And that's
Okay.
why whenever I get into a room,
Mm-hmm.
I just go there without fear, with courage. I I look at it as an opportunity for the world to know me and see me. So it's not like I get into a room and I cage. No, I
Mm-hmm.
cringe. I just come into
Mm-hmm.
a room and enjoy myself.
Yeah, that's great attitude, man. That's very great attitude. Excellent. Right. I think probably you might have briefly touched already. So you mentioned your system uses 47 factors, but
We
that
streamed
sounds
it
like a
down to
black box.
42.
So 42, is it now?
Yes, 42. So we streamed it
40,
down to 42 for two
42.
reasons.
Okay.
Yes.
All right. Okay. Yeah.
Okay, maybe I'll leave
But
it back to
that sounds
question.
like a black box to most people. Explain to our audience, how does Spadaker actually work?
So, how does Paducare actually work? So,
Mm-hmm.
the 42 factor is two things, both a marketing plan and also something that encapsulates the entire matching algorithm or matching system that connects
Mm-hmm.
a carer to
Mm-hmm.
a service user. So,
Mm-hmm.
how does Paducare work? Very
Mm-hmm.
simple. We
Mm-hmm.
have now tailored Paducare directly to healthcare recruiting agency, and
Mm-hmm.
we help them streamline three most important problems that's
Mm-hmm.
facing the healthcare sector. We're not solving everything. We are
Mm-hmm.
solving the first thing, which is recruiting. So
Mm-hmm.
we help the agencies because one of the big challenge in the healthcare sector is
Mm-hmm.
volatility of carers. You can get a carer today, next week they are out, and the
Mm-hmm.
turnover on carers is a lot. So part of
Mm-hmm.
care helps with
Mm-hmm.
streamlining the recruiting process. The second
Mm-hmm.
part is compliance. We help
Mm-hmm.
with making sure that there is nothing going out of check, their DBS, their right to work, everything, their
Mm-hmm.
mandatory training, the
Mm-hmm.
everything
Mm-hmm.
that
Mm-hmm.
contains the 42 factor. They make sure
Mm-hmm.
that they are always compliant, not to get fined by the CQC, not to get to have a student who is supposed to be working 20 hours work week to be in
Mm-hmm.
term time to be doing overtime, to be doing
Mm-hmm.
over 20 hours work week. So everything with compliance, we solve that.
Mm-hmm.
And
Okay, very good.
finally,
Mm-hmm.
operations. So
Mm-hmm.
we help with operation, making sure that the carer knows where they can clock in, clock out,
Mm-hmm.
a
Mm-hmm.
payroll system, and everything. So that's how the three ways
Mm-hmm.
it works. Thank you.
Excellent. Okay. So again, so if you want to capture that, I would say, so you got your focus is on continuity of carers, compliance, and operational efficiency in
Abs-
as the three pillars of Pedicare
Absolutely.
focus
Absolutely.
areas. Okay.
Absolutely.
Excellent. Excellent. Right. Okay. So now you tell me, what is the evidence it works?
What is the evidence it works? I like
Yeah.
that. Actually, no one has asked
Yeah.
that. So yeah, we're currently running a pilot with HWI,
Mm-hmm.
and to be honest, currently they use a system. They've got a system that they use, but it's
Mm-hmm.
more of a legacy system.
Mm-hmm.
Currently, we're like I said, we've been able to save them 3 weeks of work with
Mm-hmm.
under 1 hour.
Mm-hmm.
There are also a lot of things that shows that it works from our clock in and clock out system. We have a mobile app where the carers
Mm-hmm.
use and tracks everything, and
Mm-hmm.
we have built the best solution out there.
Mm-hmm.
We've sampled all our competitors. And
Mhm.
I can tell you that Paddlecare is the best application that
Mhm.
streamlines workflow, make sure everything
Mhm.
is compliant, make sure that
Mhm.
the carers even track the travel miles of the
Mhm.
carers when they clock in and they clock out. So
Mhm.
we've built a system that is robust and solves the problem. And the client is happy and we are happy. I think our
Mhm.
bank account is the one that is saying it works.
You're a happy man. I can see that. Excellent. Excellent. Yeah. Right. Okay. So we talked about your clients. Those are the suppliers of carriers and you as your business. Can you share a story where Padacare got it right and it made a difference for a patient?
Hmm. Can I share a story where Paddlecare got it right?
Mm-hmm.
I think I will skip on that
Mm-hmm.
because of
Yeah.
confidentiality
Yeah.
of the carers, and besides, we are providing the solution directly to the care recruitment agencies, and so
Mm-hmm.
we are not really in that. We
Okay.
can't
I
really share
understand.
that information.
No
Yes,
problem. Yeah. Sorry. Yeah. Okay.
thank you.
Just my right. Okay. So listening to you, your path wasn't smooth, and OB dissolved. Your visa was once rejected. I guess you faced some setbacks that would stop many people.
Mm.
But what kept you going, Okare?
What kept me going? I think I look to my deathbed and I just look back and say, what would I have done? So, would I be known as someone who quit? Would I be
Mm-hmm.
known as someone who did not go for it? Or would
Mm-hmm.
I be known for someone who aimed low and
Mm-hmm.
got it? Or
Mm-hmm.
who aim high and miss? So I
Mm-hmm.
aim high and I keep missing till I get it.
Right. Yeah. Yeah. Okay.
So my
Yeah.
story is, it's just the staying power. I think I learned something when I was younger, because
Mm-hmm.
when I was younger, I couldn't stay in one place. I had so much energy, so much restlessness. I couldn't find myself to sit down in one place. And
Mm-hmm.
someone taught me about the staying power. And I
Mm-hmm.
put myself through that process of learning how to stay. Like even when we
Mm-hmm.
go to like churches or a seminar, you would ever
Mm-hmm.
always see me go out. I would either go out to go and take a loo or just be restless to go and do something. But I
Right.
decided
Right.
to train myself to stay in one place. So it's the same
Mm-hmm.
thing I've applied to both business, both life, both any challenge. I
Mm-hmm.
get feedback from it. So when I was rejected for my first visa application for the
Mm-hmm.
global talent, I took the
Mm-hmm.
feedback and I
Mm-hmm.
worked on it. So we are
Mm-hmm.
all in learning, we're all in a learning curve. We're all getting feedback and using it to grow. Right.
Yeah, yeah. Excellent. That's a great attitude again, Okare. Excellent. Right. So now, can you tell us what was your lowest point and how did you climb out of it?
Oh wow, I think there've been a lot of low points.
Not just one, maybe
Not
many.
just
Yeah,
that. You can
yeah,
imagine with the kind of life that I live, with the kind
yeah.
of life that I try to dare to be different, try to dare
Mm-hmm.
to chart my course. You can imagine
Mm-hmm.
there's been a lot of lows.
Yeah.
Okay, let me just relate it with Paddlecare. So for 1 year straight, we made
Mm-hmm.
no traction.
Mm-hmm.
People ghosted us on demos.
Mm-hmm.
Introductions were not, even when we're introduced to people, they did not take us. We got
Mm-hmm.
several feedback. I got feedback like, oh, I don't do business with Nigerians. They are not professional. I
Mm-hmm.
got feedback. I
Mm-hmm.
got a lot of negative feedback, but I used it
Mm-hmm.
as fuel. I kept
Mm-hmm.
going. Okay, we are
Mm-hmm.
not professional. You know what?
Mm-hmm.
We're going to
Mm-hmm.
build the best application. Oh, we
Mm-hmm.
need to even do, now we are working towards ISO 27001, ISO
Mm-hmm.
9001, cyber essential. That is part
Mm-hmm.
of it. You're saying that we're not professional. We take it as feedback and we use it
Mm-hmm.
as fuel. But I
Mm-hmm.
remember one day, I think my account was already at zero, like zero, zero. There was nothing.
mm,
And I went for an event called the platform event, and
mhm,
there I was. There was so
mhm,
much pressure. Money wasn't
mhm,
coming in. I've got two
mhm,
children, and
mm,
I just went out. And
mhm,
that day I literally cried. I was like,
mm,
God, what else do I need to do? I am doing
mm,
everything I need to do in my power. And then I
mhm,
realized that when there's a vision, no
mm,
matter what you do, it just amounts to 30%. The
mm,
70% is out of your control. And I
mm,
believe that God really answered me, and
mhm,
connected me with the right people, and you know and there my business started, uh, getting traction. We got someone who did not just
mhm,
take a demo, decided
mhm,
to trial it,
mhm,
and even walk with us through all the bugs and everything, and making sure that everything works. And today
mhm,
we are in a place where I'm really happy to say we're ready to grow. My inbox is always filled with people saying, "Oh, we want to buy paddle care. We want to buy paddle care." I'm like, we're just
mhm.
getting started.
And after all the struggle, so that's
After
really
all
worth
this
it,
stuff,
man. So you
ex-
stuck with it. So
ex-
that's amazing. Excellent.
exactly.
Right. Okay. So if your previous venture, Orbi, had succeeded, do you think Padacare would exist today?
Hmm. I keep This question is so powerful, because I think about it. What
Mm-hmm.
would my life have been if my partner at that time, or
Mm-hmm.
my co-founder, had not pulled the plug?
Mm-hmm.
If Obi had succeeded,
Mm-hmm.
maybe not. I
Mm-hmm.
believe that everything happens for good. Obi was
Mm-hmm.
meant to fail for me to be here today. I believe that
Mm-hmm.
nothing was a coincidence. Obi
Mm-hmm.
failing taught me character. Obi failing taught me groundedness. Obi
Mm-hmm.
feeling taught me to be humble, because when we were building Obi, oh, I felt
Mm-hmm.
like I was on top of the world. I felt like, there was nothing that I touched that would not work. At that time,
Mm-hmm.
yeah, at that
Yeah.
time I was like, it was it
Mm-hmm.
was borderline between self-confidence and ego. But right now,
Mm-hmm.
it's just self-confidence and humility. And I
Mm-hmm.
know right now that, yes, self-confidence
Yeah.
to believe in the
Yeah.
vision, but
Yeah.
humility to know that it's only God that makes everything happen.
Absolutely, absolutely. I totally agree with you, man. I also kind of observe people, and so you confidence is good, self confidence is good, and ego to some extent. But there is a fine line. So
It's a
when
thin
that
line. Yeah.
confidence becomes overconfidence,
Overcome.
um, and then you are treading kind of even one more level upwards and onwards,
Yeah.
then if there is not a you don't if you don't build a system of someone kind of spotting that and mentoring you and say maybe there's something that you need to course correct, and
Mm.
sometimes yeah, it's the experiments of life in a way. So then obviously, as you said, we all come to know after some point, okay, fine,
Yeah.
so it's like the world is so big,
Yeah.
so there's there are so many people better than us already in various fields of their life. We
Absolutely.
are getting started. Having that approach of we are at still ground zero, and approaching with humility. Only thing I can contribute is I'll keep learning, I'll keep
Mm.
fighting,
Hmm.
I'll move forward. So if we have that kind of approach, I don't think so. But I think the success is kind of guaranteed, in my opinion. So yeah, excellent.
Absolutely. Absolutely. That's it for me. Like, I don't think of if, I think
Mm,
when. The question is,
mm,
when will that be? So how
yeah,
long will I stay? Is it a
yeah.
week? Is it a month? Is it a year? Is it 2 years? Is it
Mhm,
5 years? Because
mm,
my goal is to take Padoke to a place where we go public, we IPO. I am not, I like I said, I don't do small and eat. I do big
mhm.
and miss. I will
Yeah.
take the
Okay.
feedback and learn,
Yeah.
and try again. So yeah.
Mm-hmm. Excellent. Excellent. Great approach. Right. Okay. Fast forward 5 years. What does A mean for elder care? Will we see robots replacing carers?
Hmm.